Welcome to Redbeard Radio. I'm Brian Keith, and today we're talking about something that is both not happy but also happy. We're going to start off with a sad story, which is once upon a time, I had some really negative medical experiences where I got an infection and the doc said, take some drugs, take some antibiotics. And I said, okay, because you do what the doc tells you to do. And then I got the infection. It came back again and the doc said, take some more drugs. And I said, okay. Took some more antibiotics because I did what the doc told me to do because that's what you do. And already the infection came back a third time. I know now there's 3 drugs instead of 1. Oh, and then it came back a 4th time. And now there's again 3 different kinds of pharmaceuticals. And this infection came back a 5th time. And I thought, I don't think my doctor knows what he's talking about. He's told me this is impossible. The specialist told me this is impossible. And I got the sense that, wait a minute. Why am I letting these other people make all these choices for me when all they're doing is the same thing? And I even said, what if the root causes around this have to do with my lifestyle, with not eating enough vegetables, being too stressed out, et cetera, et cetera? I said, no. The only option is to do more drugs. Well, folks, I left the idea behind that my doctor always knows what's best, which is particularly funny as our guest today on Redbeard Radio is Dr. Philip Ovadia. Joining us again, you caught Dr. Philip in episode 95 on how to stop sacrificing your health for the sake of your business. If you didn't get that, go over to redbeard.am and go give it a listen. But Dr. Ovadia is here today talking about what I discovered back when I stopped taking all these drugs, what I got a taste of, this idea of health sovereignty. Dr. Ovadia, welcome back to Redbeard Radio.
Thank you for having me back, Brian, and I'm really excited to introduce people to this concept of health sovereignty and help them to realize why it's so important to them.
Yeah, it's critical, and it's not something I grew up thinking about. I grew up, as did I think a lot of us, with the doctor's orders, right? That's a phrase used, doctor's orders. And that's normal, right? That's normal. You just do what the doc tells you to do.
Yeah, I think it was normal. It is normal. And you would hope that your doctor always has your best interest in the forefront of their minds when they're giving you advice. But it is important to realize that doctors are only supposed to be advisors. We're not supposed to be telling people what to do. We're supposed to be giving them information to help them make better decisions as to what they need to do in order to support their health.
I think one of the big ideas that I did not get earlier in my life, I didn't really grasp it, is that I actually have the most information about my body and my mind and my spirit. That I can go to a professional and they can give me information, but that I have the most information. And so I should be at least an active participant instead of what I used to be, which was a passive, oh, I should do this? Okay, give me that pill. And that's one of the things that you talk about in your work at Ovadia Heart Health about this active participant thing that when people go to you to do their concierge heart thing and go get advice on how to be metabolically healthy, it's not a Dr. Ovadia is just going to go tell you what to do, right? Because that's the model that's broken. That's the model that failed me when I was younger. And that's the model that's failed a lot of people.
Yeah. And even taking a step back, we have to realize how the health system has failed to do this. Doctors, in many cases, are no longer sovereign. Doctors are oftentimes told what to do by the government, by insurance companies, by the pharmaceutical industry, and doctors themselves have lost a lot of the sovereignty that they used to enjoy. So even if a physician might think that there is something that might be best for their patient, they oftentimes are beholden to things like guidelines that might tell them otherwise.
Even my family doctor who I grew up with, his practice, the person who bought it after him ended up selling it out to one of these huge medical corporations. So even the family doctor, the guy in the back of the wagon with a little doctor's bag from the Western movies, that idea, that archetype in my head, it's out of date even now. That person doesn't really exist for the most part, but I still think it does.
Yeah, that's largely true. When you look at the statistics around, how many doctors are in private practice truly working for themselves, those numbers have gone down drastically over the past 20 to 30 years. And even doctors who are in independent practice, you have to realize that oftentimes the amount they get paid is tied to following certain guidelines, meeting certain criteria, which in theory are meant to help improve the quality of medicine. But the reality is that there's very little evidence that these measures have actually improved the quality of medicine.
We think about dealing with a post office, a huge organization dedicated to keeping costs low. It's not the best experience. And yeah, the mail often gets where it's supposed to go, but there's all these corners that get cut and all these problems that happen because it's a huge organization. And huge organizations, they just can't be as effective at really seeing the individual as a doctor in private practice who actually could spend hours with you.
Yeah, many of these guidelines, are based upon the concept that there is one best way to treat everyone.
Mm.
And the reality is that's just simply not true. We are all individuals. We all have different genetics. We all have different environments that we grew up in and that influence us today. And so the whole concept that there is one right way to treat everyone, I think, is actually a flawed concept. And unfortunately, it has really taken control of medicine.
I was watching a video the other day of this guy going sailing for days and he was eating pizza. And he said, that's my habit, is when I leave town, I eat a pizza. So his first day and a half on the boat, he's just eating pizza. And I thought I would be so ill if I just ate only pizza for a day and a half. Because as I've changed my diet to be more and more carnivore based, that I'm actually less tolerant of a lot of things that I used to be way more tolerant of. And at the same token, I know some people who are very high performers in life and business in all kinds of ways who are vegan. And their physiology, their gut flora, it's completely different than mine. Not completely, but you get the point. It's very different from mine. And if I tried to eat what they eat, I would fall apart. And if they tried to eat what I eat, they would fall apart. So the whole, there is one size fits all, even when it comes to diet, it's preposterous. We are so different. Let's talk about health sovereignty. We've talked a bit about how relying on your doctor to always be the single arbiter of truth is not the best idea. But in your work, you do metabolic health, so helping people take care of their metabolic health, take care of their hearts, and go really address problems before they wind up on your table, which for folks who didn't listen to the earlier episode with Dr. Ovadia, you're a heart surgeon, so you do cut people open. But your goal is to do less of that. So you started Ovadia Heart Health. You're helping people address problems before they become a big problem. Let's talk about health sovereignty as it relates to what an individual can do to really take responsibility for themselves. What's one thing that you see that a lot of the people you talk to could really do to take better care of themselves?
Well, I think number one is really health sovereignty. I think people need to be taking an active role in their health. When I look at the patients who come to my metabolic health practice, the number one predictor of success is their interest in their own health.
How do I gauge that? And if I go through whatever assessment you have for that and I find that I'm lacking, how do I change it? Doesn't that seem like sort of a native thing, like you can't really change how interested you are? Or is there some way to change it?
Well, again, I think it just comes down to making that conscious decision. Your audience is largely entrepreneurs and business owners who, obviously have taken that step in their lives, in their professional lives, to take control of, how they make a living
Mm-hmm.
rather than working for someone else. They've chosen to build their own businesses and work for themselves. And I think you need to apply that to your health as well.
Now, that's a big thing because when I think about how much I got taught about business in high school, the answer was not much. I mostly learned from seeing my parents who were both entrepreneurs. And I took business classes in college, got a degree in entrepreneurship. So I have taken a whole bunch of formal training. And I've read a bunch of books on business stuff from all kinds of different details. But I'm trying to think of any book I've read or any class I've taken that was how to master your health sovereignty or health sovereignty 101. And Philip, I'm drawing a blank here. I think I've listened to a podcast or two that talked about this topic. I don't really know where to start.
I wish there was a book that I could point people to. I certainly explore this concept in my book that's going to be coming out in November of this year. It's called Stay Off My Operating Table, and health sovereignty is one of the concepts I talk about in that book. But just like being an entrepreneur doesn't mean that you go at this alone. It means that you take charge of it but you find those resources and you find the partners that are going to support you to do that. I think it's very similar for health sovereignty. It doesn't mean that you should never go see a doctor. It doesn't mean that you should, be doing unguided experiments on yourself. It means that you should be seeking out physicians and other partners who are going to be actively involved in improving your health as well. But ultimately, you're guiding the ship and you're the one that's going to make the decisions that are best for your health.
Here's the problem. Here's my problem. I don't know how to evaluate doctors. I know a lot about a tiny number of things, like mountain climbing, sailing, podcasting. There's a handful of things here, marketing, but I don't know how to evaluate a dentist, a primary care physician, a naturopath. I guess I could read some reviews, but I don't even know how to find or how to evaluate the right people to be my partners in health. So even before, should I trust this particular person, I don't even know who I should try to be evaluating beyond what the insurance company says, you can choose from these people.
Yeah, and that really is a tough one because we don't have one site that ranks all doctors in any meaningful way. Really, like many things in life, it comes down to networking and talking to people who you trust about other things, about maybe who they see, who they use as their physicians, who they use as their health information sources. And a lot of it just comes down to trial and error, similar to business and partnerships, that you choose to form in your business life. Sometimes you just got to try it. And what you do know, what everyone does know, is how they feel and whether they feel good or they don't feel good. If you're honest to yourself about how you feel, that will help guide your medical decisions. I think the mistake that a lot of people have come to make around their health is that they've come to accept poor health and they think it's just normal. And their physicians think it's normal as well.
Poor health, that feels like a really relative phrase. That if last month you couldn't run at all, and this month you can run for 5 minutes before you get gassed out, that might be a huge improvement of your health. Whereas someone else who couldn't walk for a mile, and now a month of training later, they're able to walk for a mile, they might be like, man, I'm in great health compared to where I was. So how do I even know? Like I've occasionally gotten injured doing various activities, and sometimes I don't know that I'm injured, right? And then I go into the massage therapist or the chiropractor, and afterwards I finally heal. Like, wow, that pain's gone. I didn't know I was in pain. I just sort of lived. I didn't know that I was hurting. So how do I know if I'm feeling okay or not? How do I even assess that?
Well, sometimes that is difficult because, like I said, we have many times come to accept not feeling good as normal. The narrative is, oh, as I get older, it's normal for things to hurt and for me not to be able to perform in the same ways that I have performed, or it's normal to be more tired as I go throughout my day. And once someone truly does take control of their health and gets truly healthy, I look back at how unhealthy I had become.
Mm-hmm.
And anyone who listened to our first episode, knows that I was a overweight, pre-diabetic heart surgeon. And yet I didn't really realize that I was unhealthy for quite a long time. When I look back now, I just realize, all of the things that I came to accept as normal. And unfortunately, I think a lot of doctors come to accept these same things for their patients as normal, being tired throughout the day and not having energy to do things. And it just really takes that paying attention to your inner voice to realize when things are not quite right.
Let's go give some support to that inner voice. One of the pieces of your work that's really interesting to me is you dive way more into numbers on blood work than anyone I've come across. And that's interesting because your assertion, which you can correct however I phrase this, is that by regularly getting your blood work done and looking at the results yourself, as in everyone listening to this, and learning what the results of these 5 or 10 tests mean, that can be a powerful tool as you pursue your own health sovereignty. And then you can be talking with your doctor from a position of knowledge of actually having some data. You can say, okay, I see these numbers, this number's here. It changed like this since last time we looked at the numbers, and you can have an informed conversation. So first off, edit that if it needs editing before I put words in your mouth too much. But also then, what are those numbers that you feel like are the best numbers to know for supporting your health sovereignty?
Well, I think it's a matter of being able to look at the right numbers and the right tests and properly, interpret what they mean. And again, oftentimes this is difficult because many physicians don't do this well. So for me, I look at, the pillars of metabolic health. From a laboratory standpoint, from a blood work standpoint, there are three laboratory tests that are official measures of metabolic health. And they are your fasting blood glucose, so the amount of sugar in your blood when you haven't eaten for approximately 12 hours, your HDL cholesterol, oftentimes called your good cholesterol, and your triglycerides, which is another number that is on the cholesterol panel. And the problem is that while most physicians order cholesterol panels as part of sort of their routine health checkup, they only look at the LDL cholesterol number, the bad cholesterol number, and they guide all their decision making based on that because honestly, that's what the guidelines say to do. And yet it's the other two numbers on that cholesterol panel, the HDL and the triglycerides, that are actually the determinants of metabolic health.
And the fasting blood glucose.
And then the fasting blood glucose as well.
So for a person who is hearing this and thinking they feel like they're ignorant, like I do, what's the step that someone can take, a concrete action for someone who wants to increase their level of health sovereignty, understand these tests better, and go walk forward with taking more control of their own health?
Well, again, I think step number one is deciding that you want to do that. You need to tell yourself, I am no longer going to accept poor health, or I am no longer going to accept not knowing the true status of my health. And then seeking out, the proper partners to do that, whether it's a physician like myself or, a local physician or anyone that you find who will support your goal to do exactly that.
Is there any kind of quiz where someone can find out what their current measure of health sovereignty is? I think about there's all kinds of financial quizzes like how are you doing financially? Or what's your knowledge like about mountain climbing? There's quizzes for everything, right? But I can't even tell how I'm doing, whether I'm really at the basement and I'm really doing crappy in my health sovereignty, or maybe I'm doing pretty good. I don't know. How can people find that out?
Well, I think the best way to start is by assessing your metabolic health, which I think is at the root cause of most of our health problems. Having poor metabolic health is at the root cause of most of the chronic diseases that we suffer from. And if people go to ovadiahearthealth.com and click the Start Here button on the homepage, it will get you signed up for my email list. And the first thing that you'll receive on my email list is a metabolic health assessment quiz. And it's a simple, takes about 10 minutes to fill out. The important thing to realize about that is a lot of people won't have that information readily available. And if you don't have the information available to answer all the questions in that quiz, I think that's a good sign that you have not established health sovereignty. And that can be a great first step to figure out how to get the proper testing done and get that information.
It's sort of like feeling rich because you've not looked in your bank account in a year and you haven't bounced any checks. Like, oh, I'm probably good. That's how a lot of us go through in terms of our metabolic health, right? Like, oh, I can still move. I feel good. And yeah, we might be good, or maybe there's something happening there behind the scenes that's just waiting because we're not looking.
Yeah, I think that's a very good analogy. I think there are many parallels between sort of financial health and metabolic health. And I think that if any of us went to our accountants and asked how I'm doing, financially, and they gave you an answer such as that, oh, you haven't bounced any checks, you must be doing okay, not many of us would stand for that.
Right. So, folks, to go and pursue more health sovereignty in your life, you got ovadiahearthealth.com. That's OVADIA, hearthealth.com. You have at iFixHearts on Twitter is where you can find Philip on Twitter. And I'll say one last thing, which is as you're thinking about your own health sovereignty and you start to get that more under control, the next step is really the people around you. That we've seen some data that talks about how some issues like obesity, they act as if they're transmitted between people, where if you have friends who are not healthy in whatever way, you're more likely to not be healthy in that way. So as you increase your own health sovereignty, just be thinking about how can you go help those around you, those people you're around the most, and the people you love and care about, increase their own health sovereignty. And you can use that same quiz at ovadiahearthealth.com, pass that off to a friend or a loved one and say, hey, take this thing. And then if they also discover, I don't know that number, then that's an opportunity to go ahead and have a conversation with them. Maybe share this podcast, share Philip over there on Twitter. Philip, thank you so much for being on the show. And I'm going to go take that quiz, which we'll see if I can even finish it. We'll see if I know everything. I sort of feel like maybe I don't, which is part of the point.
I think that's a great point. And thank you for having me back on. It's always a pleasure to be able to help your audience improve many aspects of their lives, not just focusing on their businesses.
Folks, wish me luck. OvadiaHeartHealth.com. I'm going to go take the quiz. Talk to y'all later.